Welcome to Trahant Reports, an occasional conversation about healthcare and Indian country. I was just reading a job announcement for a really great gig. Paid $15 an hour, flexible hours, important work. It's classified as long-term temporary. That's another way of saying no benefits. In a country that has opted for an employer-based healthcare system, this should be the smoking gun. Primary evidence that it's a mistake to tie health insurance to our work. But under healthcare reform, this would be an employer mandate, and the company that put out the job announcement would be required to pay insurance or pay a fine. The letterhead on the job announcement says U.S. Census Bureau. The same government that demands that employers offer healthcare tells its own workers simply no benefit. This is not uncommon, either in government or in the private sector. Some 12% of the workforce is classified as part-time, and employers design jobs keeping in mind a rigorous enforcement of that 30-hour week. A few employers do provide health benefits to part-time employees, but there are also people who work 2-3 part-time jobs without benefits. The Census Bureau at the healthcare opens up all kinds of other questions. The United States would have to write a subsidy check under healthcare reform for the individual it hired on the cheap in order to save money on benefits. The individual mandate that has been called the common thread in all healthcare reform proposals in Congress. The idea is to require the purchase of health insurance, much like you do now with automobile liability insurance. Congress would then subsidize the cost of that insurance based on income levels. That would either be in the so-called public option or in private insurance. This is where it gets really thorny for Indian country. Would a treaty right to health care be considered insurance under the law? Or would individuals eligible for the Indian Health Service be required to purchase insurance under a mandate? And if so, would the subsidy be automatic or based on income levels? The result could end up with some sort of means test. A working paper by the staff of the Senate Indian Affairs Committee, Chairman Brian Dorgan from North Dakota, calls for a blanket exemption of individual Indians from the mandate. The paper says exempt Indian tribes from any employer mandate penalties and individual Indians from individual mandate penalties, in recognition of the U.S. federal government's trust responsibility to provide health care for American Indians. Financial penalties should not be assessed for failing to buy insurance coverage. On the House side, the pending bills do not spell out such protections, and there's a lot of debate about what those final words will look like in the final House bills. The National Indian Health Board put it this way on August 14th. Now is the time for Indian country to reach out to congressional members. It is extremely critical that Congress hears about the support for healthcare reform and the need for specific provisions to address the unique nature of the Indian healthcare delivery system. The fact is, we don't know if this language will be in the final bill or what language will be in the final bill. The health reform proposals in both houses are about as firm as a pool of water. But even if there is an exemption for Indian country, how will that provision be executed? Will it apply to individual Indians living on reservations and other areas considered Indian country? What about people who move back and forth? Will they be subject to the mandate and penalties when working in the city, but free when they move home? There are also questions about the exemption for tribes under the employer mandate. Would this apply to government operations only? What about tribal enterprises, even casinos? On top of that, will the law be different for employees who are not tribal members? This is a big deal in many rural communities because tribes are the largest regional employers. Robert Blendon, a professor of health policy and management at Harvard, said earlier this month that what is being debated now is not a restructuring of the American healthcare system, but a proposed law that says everybody who works at Dunkin' Donuts ought to have insurance. Turns out millions of people work full-time, but they get no health benefits. People across the country can be heard crying, "I can't afford to pay. Do whatever you want. Just don't ask me to pay." That notion is expensively complicated for Indian country because of the fundamental declaration that a treaty right is the highest form of government promise, prepaid health care. Thanks for listening. Please feel free to comment on my blog at www.marktrahant.com.